Okay, hello everybody. Good afternoon. Firstly, a big thank you to Savannah and Andrew and the team for putting on an absolutely fantastic day. It's been excellent, and for the invitation to speak to you all today about the Australian MND Care Guideline effort, which I am very privileged and lucky to be leading at HESRI at Adelaide University. So, very glad to be here with you all today. I flew over from Adelaide this morning on the very early flight to be here, and it was very much worth it getting up nice and early. So what are we trying to do? So what we've been lucky enough to receive is funding from Fight MND to develop a national evidence-based guideline to inform best practice in caring for people living with MND. It's quite shockingly, really, there is no national guideline, or there has not been a national guideline to inform how people living with MND should be cared for. There are guidelines in many other countries and many other jurisdictions, but Australia, for whatever reason, did not actually have a guideline. So Fight MND identified this. They put a call out to guideline developers, which I am, to try to correct this issue, and that's what we're doing. So we're trying to get all of the evidence, all of the information, all of the collective knowledge of people like yourselves to inform this evidence-based guideline, with the ultimate aim, of course, to improve quality of life for people living with MND. So it's a 4-phase project. So the first phase was all about setting ourselves up for success, building our governance structures, recruiting people to our panels, advisory groups, and also seeing what had been done in other countries as well, to see what we could use or build upon. And then we've completed that stage, and now we're in the thick of the development stage, where we're doing a lot of systematic reviews of the literature, looking at all of the studies that have been published relating to anything related to the care of people living with MND, and we're searching and sifting through all of these peer-reviewed studies and creating a map of studies which we're using to inform our guideline. And obviously within our guideline we are making lots of different recommendations following an evidence-based approach. Once we've completed this stage, it'll all be about trying to get this into practice, actually trying to get people to become aware of the guidelines and start to use them in their everyday work and life as well. Because what we are hoping, of course, is this guideline, that it doesn't just sit on the shelf, but it actually does lead to measurable and demonstrative improved outcomes for people living with MND, and improvements in structures and processes as well, and also addressing some of these health inequities which Karen talked about a little bit earlier also. So the way that we're doing this is we're following kind of best practice standards in how we develop guidelines here in Australia and internationally. And within Australia we have the National Health and Medical Research Council, and they are the main guideline development body in Australia, and they develop a lot of public health guidelines, and then they approve a lot of clinical guidelines. And we're following their guidelines for guidelines and seeking endorsement of our guidelines recommendations through the NHMRC as well. When you get NHMRC endorsement, the recommendations then flow through the health system at a federal and a state level, through the Ministers of Health and through to the local health networks, etc. So, we're seeing this as the best way to actually get penetration into health services. So we actually have submitted our first recommendations to the NHMRC for approval, which is really exciting. We're also following methods called GRADE, and I'm the director of the Adelaide GRADE Centre, but I won't bore you with the very technical details of that today. So we've been really lucky. In fact, I've been blown away by the MND community in Australia. We have over 200 people involved in the guideline, people with lived experience, people from every state and territory, people representing all of the different health professions involved in the care of people living with MND. And in fact, there's quite a few people in the room who are contributing to the guideline. And before you rush off today, if we could all get together and get a photo for those of you who are on our advisory group or panels, that'd be really good. So we have our panel, which is kind of at the heart of the guideline. This is our decision-making group. Here we are at our kick-off event. It's 20 people representing, different professions, carers as well, people living with MND, and we've done our best to get geographical representation. Okay, there's been a lot of training as well of this network. We are still, if you're interested, we are still having people join our advisory groups. This is a multi-year project. And particularly if you're from a rural or remote setting, it would be great to have you join as well. But really, if you'd like to be involved, please do let us know. Like I mentioned, we've done this evidence and gap map. So we've literally looked at every single paper ever published related to anything to do with MND care, and we've started to categorise all of those papers. And we've developed. I'll just move on. We've developed this living evidence and gap map so that you can actually look and see all of the previous studies, what they looked at, what interventions, what care strategies, what type of study it was, etc. And we've done this to help form the evidence base or literature for our guideline. And these are actually publicly available now if you're interested to look through those. Okay, in terms of what topics we're looking at, we to determine the scope and topics and questions for the guideline, we've done a community survey, we had some workshops, we had a large kick-off event, and eventually we got down to 51 questions under 12 topics, which we are going to address in the first version of the guideline. There are actually over 1,200 suggestions for this guideline, which we whittled down to 300, and then we further whittled down to 51 questions. But we hope we'll be able to address the remaining questions in subsequent versions of the guideline as well. We're getting a lot of feedback from the community. So Ian, you asked that question about how do we get that collective knowledge from all of the experts in the room. We're trying to do that as part of this guideline through our feedback processes, and particularly when there are no studies, there is no research literature or evidence, we need that collective knowledge and expertise and experience from all of you to tell us actually how you fix this problem or address this issue. Sarah, I hope we can MacGyver some solutions as well when there is no literature. Okay, so where are we now? So like I said, we've drafted our first recommendations. We're doing a lot of the evidence work for our other questions. We've submitted the first recommendations on some disease-modifying therapies to the NHMRC for approval, and also a recommendation about diagnosis of MND, because we know that this is often taking far too long, and we hope to address this issue as well. Okay, so we're going to continue this. We're continuing this work. We hope that this will be a living guideline, so that it's not necessarily going to end. We're just going to keep adding new recommendations, new topics, and then updating topics as new advances in research and drug development come along, so it can always be continuously up to date. And we've done a lot of engagement things and tried to really become a part of the MND community, because this guideline should be owned by the MND community as well. So I think I'm probably done. I heard the buzzer beeping. I presume that was for me. So I just wanted to say a big thank you to everyone who's been involved in the guideline to date. If you would like to be involved, please scan that QR code, or send me an email here, zacharymunn@adelaide.edu.au. And then just a huge thank you to Fight MND for identifying this gap and funding this work. But to everyone who's been involved, a huge thank you as well. And please do get in touch. Thank you.